interrelated risk factors, retrieve these factors, assign a value, and then recombine them mathematically, because recombining them mathematically may not be the same as when they're together biologically. So a bunch of different people put in their models. They said, we've got a mathematical model to calculate a woman's risk, but the one that captured the hearts and minds of epidemiologists everywhere was the Gale model. And you may have heard this, you may have already had it done on you when you visit your physician. And that is just some simple questions, and within 30 seconds you have a risk number for breast cancer. The reason it got selected as the gold standard was because a big tamoxifen prevention trial needed to know how many women were going to get breast cancer out of a large group so they could statistically prepare their study and know how many women to recruit. They have to know in advance. And so they picked the Gale model to be the method to enroll women, and thereby it became the standard. I'm not going to go over all this. I'm just pointing out that it's a computer program or a handheld calculator. Fill in the numbers, and out comes your risk. You can do a 5-year risk, lifetime. You can do the newer version of this. There's a Gale Model 2 out now. It actually gives a little better baseline risk information, but it also lets you pick the number of years interval you want to do, which is a good idea because the shorter the better. We start doing lifetime risks, and we're making some assumptions we don't know. The studies that began the process rarely go beyond 20 years, and so we don't know